number of Australians living with HIV has gradually risen over the years. But just how many people are infected with HIV in Australia? It is estimated that there are 26,900 people in Australia that live with HIV. Of these, approximately 24,100 are men and around 2,800 are women. Individuals with HIV/AIDS that are of a low socioeconomic status can be particularly vulnerable and encounter further issues. Low SES groups generally have a high prevalence of risk factors and greater health needs. There is strong evidence that suggests low SES is associated with reduced health. Low socioeconomic status groups bear a significantly higher burden of disease. HIV is a disease that is embedded in social and economic inequity, as it affects those of lower socioeconomic status at a disproportionately high rate. Studies investigating socioeconomic status in HIV/AIDS suggest that a person's socioeconomic standing can affect his or her probability of contracting HIV and developing AIDS. SES is a major factor in shaping the quality of life for individuals after the virus affects them. Socioeconomic status often determines access to HIV treatment. Individuals of low SES have delayed commencement of treatment relative to more affluent patients, decreasing their chances of survival. Morbidity and mortality rates are also higher among patients of a lower socioeconomic status. Research suggests there is a correlation between low SES and earlier death from HIV/AIDS. A major contributor to health gaps between high and low socioeconomic status is lowered access to preventative services and healthcare insurance. Socioeconomic status at both the individual and community level affects various types of stigma. Stigma towards persons with HIV still poses a significant barrier to curbing the pandemic. Self-stigma or internalized stigma has an equally damaging effect on those with HIV. Stigma and discrimination have been correlated with risky behaviour and poor access to healthcare. Stigma often discourages them to seek prevention and testing services, as well as treatment. There are multiple levels of stigma that can arise. These include community and household, employment, healthcare, and governmental stigma. UNAIDS stated that 61% of countries have legislation protecting people with HIV from discrimination. However, many countries still discriminate. In the UK legal system, people can be prosecuted if they pass the virus onto somebody else's, even if there was no intent to. Healthcare stigma can include lack of confidentiality and lack of prioritization. Community and household stigma can involve physical and mental abuse, segregation, and just overall mistreatment. In the workplace, people with HIV may be subject to social rejection, termination, and ridicule. As a nation, we need to contribute to the body of research on the societal barriers experienced by people with HIV and AIDS, particularly low SES groups, and how these impact achieving positive health and well-being. In order to address the stigma, compulsory HIV training should be included for all staff of all specialist, community service providers, and primary healthcare staff. Instead of a general prevention program, the programs need to be selective and specific. This is because low SES groups benefit from targeted prevention activities. People belonging to low socioeconomic groups need to be properly taken care of in order to halt the onwards transmission of HIV. In this day and age, without access to such advanced technology and knowledge, it is of utmost importance that we reduce the health gaps between low and high socioeconomic status groups. When these vulnerable people feel stigmatized, it greatly reduces their likelihood of accessing HIV services due to the fear of judgment and discrimination. These issues of stigma can be addressed within society through education and employment support to diminish the effects of stigma for low socioeconomic HIV positive